Welcome to lecture number 2, crown and root landmarks, division into thirds, line angles, and point angles. The aims and objectives of this lecture is to give you an introduction to the main parts of the tooth, understanding the nomenclature of the tooth landmarks, knowledge of the division of teeth into thirds for a better description of teeth, familiarity with line angles and point angles. The tooth is anatomically divided into two parts. The crown, which is the part of the tooth and the root, which is the part hidden in the bone and covered by gingiva. Inside the crown and the root, there is a soft tissue that we'll talk about in details later. It's the pulp tissue. The pulp tissue inside the pulp chamber in the crown, this is the chamber, and in the roots themselves, in the root canals. The crown has two hard tissues. The one that we can see by naked eye, the enamel on the surface, and underneath we have the dentine, which makes the bulk of the tooth and is found both under the crown and in the root. The roots are covered by a hard tissue called cementum. The crown and the root join each other at a point that is called cemento-enamel junction or the cervical line. The dental tissues are first the enamel, which is the protective outer surface of the anatomic crown. It's 96% mineral content and is the hardest tissue in the whole body. The dentine, which is located, as I have already explained, in both the crown and the root and makes the bulk of the tooth beneath the enamel and the cementum. It lines the pulp cavity. The cementum, the hard tissue that covers the surface of the anatomic root, and the pulp, which is the central innermost portion of the tooth. It has the formative, the sensory, nutritive, and nutritive functions during the life of the tooth. So, as I explained in the first lecture, there is different classes of teeth. The incisor teeth, the central and the lateral, has something called incisal edge. I will show you that in a minute. The canines have single cusps. The premolars and molars have two or more cusps. This is a central incisor, as you can see here. This is the apex of the root. The root itself that is divided from the crown with the cervical line. This is the root. And the crown. And here is what we call the incisal edge. The root is fixed in the bony process of the jaw that's called alveolar process. So this is the bone of the jaw, and this is a bony process going out of it called the alveolar process. The place where the tooth actually sits inside the bone is called a socket or alveolus. Fully erupted crown is partly covered at the cervical third in young adults by gingiva or gums. This red soft tissue is called the gingiva. So if we want to talk a little bit about the crown, we can have two different definitions of the crown. The anatomical crown, which is covered with enamel, and the clinical crown, which is the portion of the anatomical crown that is visible to eye clinically. So as you can see here, this tooth is covered by gingiva. This is gingiva. Accordingly, not all the crown, which is covered by enamel, is visible to the naked eye. This part is visible to the naked eye and we call it the clinical crown. And this part, which is covered by enamel from the cervical line to the incisal edge, is called anatomical crown. The root. Also, the root can be defined in two ways: the anatomical root and the clinical root. So the anatomical root is the portion of the root that is covered with cementum, which means from the cervical line to the apex of the root. The clinical root is the part of the anatomical root that is actually embedded in the jaw. Why? Because some patients have pathological problems that let part of the root visible with the naked eye in the oral cavity. So that's what is left covered by the alveolus or the socket is the clinical root. The cervical line, as I have explained, it's the line that separates the anatomic crown from the anatomic root. It's the junction between the enamel and the cementum and called cemento-enamel junction or CEJ. This region of the tooth is also called the cervix of the tooth. The cervical line is important in the lab drawings. The pulp cavity is the space in the tooth, as you can see here. Where is the pulp soft tissue that has the nerves, the blood vessels, the lymphatics inside of it. There is two parts for the pulp, one in the crown and one in the root. Incisors and canines have four surfaces and ridges, and a ridge, sorry. Premolars and molars have 5 surfaces. Surfaces are named according to their position and uses. In anterior teeth, incisors and canines, the surfaces toward the lip are called labial surfaces. In premolars and molars, surfaces facing the cheek are called buccal surfaces. Collectively, labial and buccal surfaces are called facial surfaces. Surfaces facing the tongue are called lingual surfaces. Surfaces of the premolars and molars that come in contact with those in the opposite jaw are called occlusal surfaces. In anterior teeth, the occlusal surfaces are called incisal surfaces. Surfaces facing adjacent teeth in the same dental arch are called proximal surfaces. They are either mesial or distal. Mesial is nearer to the midline, distal is the further from the midline. The area of the mesial or distal surface of a tooth that touches its neighbor tooth in the arch is called the contact area or point. As you can see here, we are looking at the maxillary arch from the occlusal surface. This is the occlusal surface, which means the surface that occludes with the other teeth in the other jaw, in the opposite jaw. You can see, for example, here, the incisors and the canines. Here should be the lip. So this surface is called the labial. In the posterior teeth, the premolar and molar, they are opposing the cheek, so we call them buccal. These surfaces that here is the tongue, these surfaces are called lingual. And the surfaces between the teeth are called proximal. So for example, in this canine, there is two proximal surfaces, one near the median line, which is the mesial one, and the other is further than from the median line, it's called the distal. And the points where two teeth meet is called contact area in posterior teeth and contact point in anterior teeth. A cusp, as you can see here, is an elevation on the crown portion of a tooth making up a divisional part of the occlusal surface, or a peak on the occlusal surface of molar and premolar teeth and the incisal edges of canines. It's the pointed end of the crown. A tubercle is a smaller elevation than a cusp on some portion of the crown produced by an extra formation of enamel. These occur on the marginal ridges of posterior teeth. We will come later to the definition of a marginal ridge, or on the cingulum of anterior teeth, and we will explain cingulum in a minute. These are deviations from the typical form, which means that they are not usually there, but when you see them, they are small, and you will actually be able to identify them as tubercles in the future. The cingulum is a bulge or elevation on the lingual surface of incisors or canines. It is the lingual lobe of an anterior tooth. It locates here. We will see it in another picture now. It is the lingual lobe of an anterior tooth and makes up the bulk of the cervical third of the lingual surface. The cervical third means the third that is near the cervical line. Its convexity mesiodistally resembles a girdle encircle the lingual surface at the cervical line. Maybe you can see it here much better. This is the cingulum in the cervical third. This is an elevation. A ridge. A ridge is any linear elevation on the surface of a tooth. It's named according to its location or form, like buccal ridge, incisal ridge, marginal ridge. We will see examples throughout the lecture. For example, this is a marginal ridge. It's a linear elevation on the mesial and the distal sides of the lingual surfaces of anterior teeth. This is an incisal ridge because it's an elevation on the incisal edge. Marginal ridges are those rounded borders of the enamel that forms the mesial and distal margins of the occlusal surface of premolars and molars and the mesial and distal margins of the lingual surfaces of the incisors and canines. I just explained the marginal ridges found on anterior teeth, but in posterior teeth we can find them here. Because this is, you will be able, and we will be familiar with the surfaces later on. This is the buccal surface of the premolar, and this is the lingual surface. So these are the marginal ridges on the mesial and the distal surfaces of this tooth. The triangular ridges descends from the tips of the cusps of molar and premolar toward the central part of the occlusal surface. The slopes of each side of the ridge are inclined to resemble two sides of a triangle. They are named after the cusps to which they belong. For example, the triangle ridge of a buccal cusp. So, to explain that, now we are looking at this premolar from the occlusal surface. And we will take a proximal view in a minute. So you will learn later that we have two cusps in this premolar. From this cusp, there is a ridge going down to the center of the tooth. Each line has two surfaces around it that makes a triangle. We can see that much better from a proximal surface. This is the cusp, the highest elevation on the crown, and from it comes a ridge going down from the cusp to the center of the tooth. Mesially and distally, you can see the surface on the mesial and the distal of this elevation, making a triangular ridge. Don't be afraid, you will be familiar with these expressions when you see normal teeth in lab and when you carve these teeth yourself in the lab. The transverse ridge are created when buccal and lingual triangular ridges join. So it's the union of two triangular ridges crossing transversely across the surface of a posterior tooth. In this molar, for example, you will learn later that we have four cusps. Among them, they form triangular ridges. Two of them in this molar, which is a maxillary molar, this is a triangular ridge, and this is here a triangular ridge. They meet together to form this transverse ridge. The oblique ridge is found only on maxillary molars. It's a ridge obliquely crossing the occlusal surface of the maxillary molars and formed by the union of the triangular ridge of the distobuccal cusp and the distal cusp ridge of the mesolingual cusp. They are a companion to the distal oblique groove. You don't have to imagine that right now, just have the information. When we explain the maxillary molars, you will be able more to understand on which cusps are we talking and how do they join to make this oblique ridge. The cervical ridges are the height of the contour at the gingiva on certain deciduous and permanent teeth, which means an elevation of the tooth or the crown at the level of the gingiva. A fossa is an irregular rounded depression or concavity found on the surface of a tooth. Lingual fossae are found on the lingual surfaces of incisors. Central fossae are on the occlusal surface of molars. This is a molar, and inside here you can see a central fossa. They are formed by the convergence of ridges terminating at a central point in the bottom of the depression where a junction of grooves occur, which means when all the triangular ridges come from the cusp, down to the center of the tooth, they form this place, or they form this fossa, which is an empty space, as you can see here also. Where all the grooves that we will explain later will join in this central fossa. A triangular fossae are found on posterior teeth on the occlusal surface, mesial or distal to the marginal ridges. So this is a posterior tooth, maxillary molar. This is the proximal surfaces, and you will see here a triangular fossa, mesially and distally. A sulcus is a long depression or valley in the surface of the tooth between ridges and cusps, the inclines of which meet at an angle. A sulcus has a developmental groove at the junction of inclines. What does that mean? That means above the grooves here, there is a grooves on the occlusal surface itself, and above this groove there is a space, a very small space, air-filled space, that is between the triangular ridges, that is called the sulcus. A developmental groove is a sharply defined, narrow and linear depression forming during tooth development and usually separating lobes or major portions of tooth. We will define lobes later. So this is a developmental groove which separates major portions of the tooth. For example, here lobes, which are portions of the tooth that forms defined portions of the teeth during development, and then they join each other. So this was a lobe, this was a lobe, this was a lobe, and when they merge together, sometimes a developmental groove is seen between them. In this molar, for example, the developmental grooves are separating the cusps of the tooth. A supplemental groove is a shallower linear depression on the surface of a tooth, but it is usually less distinct and is more variable than a developmental groove, and does not mark the junction of primary parts of teeth, which means you can find supplemental groove on the triangular ridge, for example, on the marginal ridges. They are small and shallow, and they do not separate basic tooth structure from each other. Buccal and lingual grooves are developmental grooves found on the buccal and lingual surfaces of posterior teeth, like the one here we see separating the buccal cusps of the lower or the mandibular first molar. It's called mesial buccal developmental groove. In this tooth, for example, in this maxillary molar, we can see an elevation on the cervical line here. We called it buccal cervical ridge. Pits are small pinpoint depressions located at the junction of developmental grooves or at terminals of those grooves. For example, the central pit, which is the junction of, or found in the central fossa on the occlusal surfaces of molars, where developmental grooves join. A pit is often the site of the onset of dental caries because it's a little bit deeper and hard to clean than the grooves themselves. Look, the grooves come and they all come together in the central pit here. A lobe is one of the primary sections of formation in the development of the crown, cusps and mamelons. A mamelon is any one of the three rounded protuberances found on the incisal ridges of newly erupted incisor teeth. As we can see here, These are mamelons, and they represent the 3 lobes that form the incisor. When they don't merge to the end, they form mamelons, and sometimes, as I have explained, marginal developmental grooves between them. So we'll try to summarize a lot of the terms that we have already explained. For example, here points to the central fossa where the developmental grooves join. This is the distobuccal cusp. You don't have to memorize these now. You just have to know that each cusp is named after its location. So if we say this is the distobuccal cusp, that means it's on the buccal surface and away from the median line, which means distally. The distal marginal ridge, which found, as we have said, mesial and distal. The distal marginal ridge is found in distal. The mesial marginal ridge is found on the mesial of posterior teeth. The oblique ridge that runs obliquely, as I have mentioned, only on maxillary molars. The distolingual cusp, the distal groove, distal developmental groove, the mesolingual cusp, the triangular fossa, the mesobuccal cusp, here we can see a small supplemental groove, but we need more magnification to really see it clearly. And this is the buccal groove on the buccal surface between the buccal cusps. And as I have mentioned earlier, the buccal cusp ridge, it's seen in this tooth. If we take a mandibular molar, as you can see here, 2 triangular ridges made a transverse ridge. Distolingual cusp, triangular ridge of distolingual cusp, distal cusp, distobuccal cusp, distobuccal groove, central fossa, buccal cusp ridge. It's not so prominent in this tooth. Mesobuccal groove, the mesobuccal cusp, the mesial marginal ridge, and the mesolingual cusp. In a premolar, this is a proximal view of the maxillary first premolar. You can see the marginal ridge, you can see the buccal cusp ridge, it's not so prominent here. You can see what I call the sulcus. As you can see here, at the end of the sulcus, which is this area, at the end of it there is a groove on the occlusal surface. From the occlusal surface we can see the transverse ridge, which is the cusps that runs down from the cusp to the center of the tooth. So this is the cusp ridge, this is the triangular ridge, in a maxillary molar we have already explained this is from the occlusal surface, this is the transverse ridge of 2 triangular ridges coming transversely together. This is a supplementary groove. It's obvious more here. It's a small, shallow, and on the triangular ridge. It does not separate, for example, cusps from each other. The central pit. Usually we divide crowns into thirds. because it's easier to draw and easier to communicate and locate any pathology or anything you want to locate on a tooth. So we divide it into incisal or occlusal third, middle, and cervical thirds. The root is also divided into cervical, middle, and apical thirds, as we can see in this picture. Incisal, middle, cervical, cervical, middle, apical. Also from the proximal side we can divide it into lingual, middle, labial. Also we can divide the tooth vertically into 3/3, distal, middle, mesial. But usually the most used one in our drawings is the cervical, middle, incisal thirds. For molars, we have occlusal instead of incisal third, middle, and cervical. A line angle is formed by the junction of two surfaces and derives its name from the combination of the two surfaces that join. As you can see here, for example, this is an incisor, this is the labial, as you can see, this is the labial aspect of it. So when the labial and the distal join together, we say this is, for example here, the distolabial line angle. When the distal join the lingual, we call this the distolingual line angle, and go on. The same happens with the posterior teeth. For example, you can see directions here. When the buccal and the distal join each other, we call it the distobuccal line angle. This is the mesobuccal line angle, and so on. Point angles is formed by the junction of three surfaces. The point angle also derives its name from the combination of the names of the surfaces forming it. For example, the junction of the mesial, buccal, and occlusal surfaces of a molar is called meso-bucco-occlusal point angle. For example, on this incisor, this point, where is the distal and labial and incisal surfaces joint, is called disto-labio-incisal point angle, and so on. In posterior teeth, this point, where the distal, lingual, and occlusal surfaces join, is called distolinguo-occlusal point angle. That was all for today. I wish you all the luck until next week.